Okay. So just to start again, hi, my name is Erin Ranger. I'm the patient support manager at Craig's Pancreatic Cancer Society. Thank you so much to everyone for being here today. We have a really interesting presentation today on sort of choosing hospice care and MAID, for medical assistance in dying. So we hope to provide more information and more insight on making those decisions. And so Pam Zarega has chosen to pursue hospice care. And then Barbara Green has been a major advocate for MAID, again, medical assistance in dying in Virginia and getting it legalized. So we're going to discuss more about that. So we have Ben Perry here, and he's going to host the interview of Pam Zuriga and Barbara Green. So without further ado, I'm going to pass it over to Ben.
Hi, everyone. Nice to see you again this weekend. As you heard, we're talking about hospice care and MAID. We'll start off. I'm going to introduce Barbara, only because Barbara signed in first, Pam. I'm very sorry about that. So, and I'm sorry that for having to read this. We've had a lot of stuff busy, so I have to read and as I introduce you, Barbara. But Barbara Green is a retired CPA who audited nonprofit organizations throughout most of her career. She spent 5 years at the end of her career with the Office of Inspector General of the U.S. Department of Defense, and then 9 years running her own business, providing in-home financial services to other adults who lost their capacity to handle their affairs on their own. She has 2 adult children, 2 granddaughters, and 9 grandcats, and lives in Falls Church, Virginia. Welcome, Barbara.
Thank you, Ben.
And our lovely Pam. Pam is a widow. She was married for 53 years in what would be referred to as an old-fashioned marriage, where the dad goes to work while mom takes care of everything else. She has a 52-year-old son and a 45-year-old daughter and 4 young grandchildren. She spent several years as a volunteer at resale store that provides funds, housing, and group training for abused women. And early on spent some time as a hospital volunteer. Once the grandchildren were born, she devoted her time to them, who she has always referred to her as her 4 little antidepressants. Pam lives in Deer Park, Illinois. I love that one, Pam. Antidepressants.
Oh, yeah. Oh, yes.
Great. Okay, so we're going to start off our questions here. Do you have the questions up and going there to show on the screen?
I did do that just that way we can see everybody's faces
Yeah.
a bit
You
better.
don't have to. As you want, I got the first one I have. We'll go with the MAID's question first. So, Barbara, can you speak a bit about MAID in your own words?
Yes. I'm a big advocate for medical aid in dying, and I've been doing this long before I had a terminal illness myself. It's always been important to me. I recently read about the Canadian medical aid in dying, which is significantly different and a lot the same as the laws in the US. And it's a way for someone who is terminally ill, although in Canada, apparently you don't have to have a terminal diagnosis anymore. In the US, you do. A doctor will provide you in the US will provide you with a drug combination that will make you basically go to sleep and not wake up. People may choose to do this at the end of their lives if they're at a point where they don't see any purpose in living, or the pain is intolerable, or a situation is intolerable for some other reason. In Canada, and I'm no expert on Canada's laws, so please, the Canadians should correct me if I'm wrong, but as I understand it, there are 2 different options in Canada. In the United States, you must be able to take the drug potion yourself. In Canada, it can be administered to you similar to just being injected, and you go to sleep and don't wake up. It's an option. And in Canada, it's approved in every province, different rules in different provinces. In the United States, only 10 of the 50 states, plus the District of Columbia, allow medical aid in dying. So it depends a lot on where you live. And as an American, you cannot go to Canada and use the Canadian law. I looked at that. And you must be covered under the Canadian health system, which means you're a Canadian citizen. So there are some differences between the US and Canada, but the concept is basically the same. You have reached a point in your life where you're going to die anyway. And I don't know about Canada, but in the United States, the cause of death is pancreatic cancer or whatever your terminal illness is. It's not suicide. You simply expedite you're going to die, and you would prefer to die 2 weeks or 2 months sooner. And so you have that option.
Yeah, a friend of mine, well, one of my customers and another friend had called her up to go over to visit. And the first thing she said to her on the phone, she had a terminal cancer for quite a few years, but she was fighting it, fighting and fighting. And at the end, she said, I can't take the pain anymore. So when my friend Heather called up this lady, she said, yeah, so, and as you know, at 10 o'clock on Wednesday morning, I'll be passing away, so she had really accepted that, and it's for her, the amount of years that she was spending with all that pain, it was tough, and it was tough on her and her family. And in the end, she said, like, when I'm gone, they're going to be grieving me. So if I'm gone just a bit sooner, that's less pain on them. That's how she had looked at it.
Mm-hmm.
Okay, we're going to move on to our first question for Pam in hospice care. Okay, Pam, can you tell us about how you went about accessing hospice care and what it has involved? Supplies, costs, visits, etc.?
Okay, well, for me, the decision was relatively easy because after I had the Whipple and some complications for a few weeks, then I went through the 6 months of chemo and 28 treatments of radiation. And I knew that I wouldn't do it again. And I had told my oncologist that pretty much from the very beginning. And also my age plays a part. I'll be 80 in 2 months. And I live alone. I'm a widow. And so I was just accepting the inevitable. It had spread to my lungs, both of my lungs, and it had grown and more had shown up on my last scan, which was quite a while ago. So I decided to go for quality over quantity. I'd read a lot about that. And I actually, my GP said to me that I was eligible and if I'd like to go on to hospice. And I really didn't hesitate because a couple of reasons. I was paying for the Creon, my insurance covered portion, but it didn't cover a big portion of it. Cost me thousands for the Creon. So I thought, well, and I had experience from my husband and my parents, and I experienced hospice, and I decided that I want the quality, and they're delivering all the meds I need right to my door. The hospice nurse, she comes once a week right now. She'll come more. And she's been a tremendous help to me mentally and emotionally. And so, yeah, for me, it was the right decision. And I've had quality. My last treatment was a year ago. And I'm doing okay. I'm not on any pain meds. I just take ibuprofen for some back problems. And so I'm quite satisfied with my decision.
Well, that's great to hear, Pam. And I know those of us who are in here who have pancreatic cancer, gone through all those radiation or chemo or whatever, we know what you're talking about when we said, you know what, I want quality of care. So I get it. I know when it comes around possibly for me at that point, I have to make a decision. And it's something we had talked about, the three of us there this week, yesterday. These are two topics that need to be talked about, but it's kind of taboo for everyone to talk about it. Oh my goodness, you can't talk about that, but it's things that we need to talk about it. So I want to thank you again for sharing and you know, and speaking on such a touchy subject. And I forgot, by the way, both of you, we'll go back to Barbara. I forgot to ask you to tell us a bit about yourself and your cancer story. I'm sorry.
I am happy to do that now. It's an informal discussion here today. I was diagnosed, it's going to be 2 years in, I think, 10 days. On July the 9th, it will be 2 years since I was diagnosed. I had been perfectly well until the day before, and then I woke up in the middle of the night, itching all over from head to toe. And it was a Friday, and I thought, I am not going to make it through the weekend and just scratch off all my skin. So I went to see my primary care provider and told him what was going on. I expected him to give me some kind of a cream that I was having an allergic reaction or something, but he actually listened to some other symptoms I told him about, and he ran blood work. And 48 hours later, I had a diagnosis of pancreatic cancer. Since then, I've had a variety of kinds of chemotherapy. I've now been off chemo since October. I am not a candidate for the Whipple, so they put me on a maintenance drug for a while and have recently decided that that is not working for me. So since the beginning of May, I haven't been on any treatment. I'm about to find out this coming week what the next step is going to be, but the next step for me could be the step that Pam took. I may decide I'll listen to what they have to offer, but any of us who've been through chemotherapy, and especially if you are laid off chemotherapy and realize the difference in your stamina level, chemo, as everybody on this call probably knows, is completely exhausting. And I've had a number of months without chemo, and I'm not sure I want to go back to that. So I have some decisions to make in the coming weeks.
Yeah, Pam, sorry, Barbara. I know for myself, during chemo, like you say, for me, I had to push harder than I've ever pushed for anything I've ever done. Like when I was playing sports, you push hard, you push hard. When I was on chemo, even if I wanted to get up and just go for a short walk or wherever, you had to like not put it in the second gear, had to put it into third gear just to go in first gear. Right. So I understand both of you when we say, you know what, Pam, for sure, like I can't go. I don't want that. I want to be able to still be able to walk and just walk up the stairs without getting exhausted. Now I'm 2 years, almost 2 years. I'm still NED, but almost 2 years since I've had chemo, and just the side effects that are still lingering there. It's not, I can't say it's really annoying, because at the same time, if it wasn't for chemo, I would not be here today. Right. So I'm still here, but it is, in a way, it is kind of annoying. You know, you kind of wish that there was something else we could have done to get to this position without going through that. All right. So Pam, you're up, my dear. You want us to tell us your story, your cancer journey?
Well, I was diagnosed, well, for those that are new on here, my husband passed away 18 months earlier from pancreatic cancer. And 18 months later, I was diagnosed with pancreatic cancer. So I had already gone through the whole process with my husband, and he fought more, and he had a second surgery when a tumor appeared on his spine. And then he had more chemo and more radiation. He was fighting, and he was 4.5 years he did that. And so I lived through it, and that helped me make my decision too. I was diagnosed. My only symptoms were my stomach bothered me a little bit, but my poop was like pale yellow beige for weeks
Yeah, we
and
all
weeks.
know what that all us pancreatic cancer patients here, we all know what that is. So,
Okay.
And it's okay, we can talk about it.
So that was for weeks. And then, yes, I did notice I was dropping weight. So I did go to my regular doctor, and she immediately sent me for the MRI, then the ERCP. And yes, you have it. And then I had the Whipple. I was in the hospital for a week, and then I went home. And the third day, I was home. I had a complication. I had to go back, and I had to be on a feeding tube for 3 weeks, and yeah, I had to have drain tubes and feeding tube for 3 weeks, and so then 2 months went by, and she started me on the chemo for 6 months, and then 2 months later they said 28 treatments of radiation, which I read can do nothing, can do something, and so I thought, well, I'll do it. So then by that time, I knew that I was done doing anything, that whatever was to be as a result of the chemo and the radiation, I would just go with that. I had made that decision at that time already about quality versus quantity. And yeah, and I'm okay with it.
Good. So before we go on to the next question, yesterday we got into a little conversation where Pam had said, you know, if MAID was legal here in Illinois, then I would have wanted that for my husband. But what some people don't know about it is that you need to be like, I would have to say, yes, I would like to have MAID. Someone else can't make that decision for me. So that's one of the important things a lot of people don't understand about it. So it's like you said, Barb, you don't know the rules that well in Canada because you haven't looked them up, but you're, you know, probably 95% know what's happening in the States with those. So do you guys want to get into that discussion again, or do you think we hammered it out yesterday?
Well, I think it's
Well, I
important
would
to understand that the person themselves makes the decision. There's a lot of concern, maybe more in the United States than in Canada. There's a concern about people being influenced and forced into that decision. Nobody should ever be forced into that decision. If you object for religious reasons or any other reason, and you don't believe you should do that, then you shouldn't. But some of us believe that when you reach a point where you're going to die anyway, and maybe you're going to suffer for 2 weeks and then die, that it is really nice to have the option to make it happen quickly and quietly so that you don't put your family or yourself through those final days and weeks of extreme suffering. And so it's a decision. But I think what we were talking about yesterday is if Pam wanted it and her husband was opposed, it would not happen. He would have to be the one making that decision. I think Pam said,
if she wanted it for him, she can't make that decision for him. Yeah, that's right. Yeah, and like you said, in the States, if you have what was it, ALS, and you can't physically take the pill that you have to take, you can't have it. Is that correct?
That's correct. You have to be able to ingest the potion by yourself. So it eliminates anybody who has any kind of paralysis. It eliminates anyone who has any kind of dementia condition that they can't consent to it. I mean, consent is really important. And they have a lot of safeguards, both in Canada and in the US, for having to talk to a doctor, then talk to a second doctor and put it in writing and have a witness. There are a lot of safeguards to make sure that the person is not being coerced.
Okay. I know we're getting off more on one subject than more on the other, so we're going to swing back to Pam. So Pam, here's another question. Next question for you: how do you handle negativity feedback about your choice or pity? You know, when in your current situation around, you know.
Well, everyone's different in the family. My son, he just said that he supports any decision that I make because we lived through this with my husband, so he knows what's coming too, or it could be different. So my son, he supports my decision, whatever it might be. My daughter, she has a tendency to get angry, and she was angry with my husband, and she started that with me, but my sister had to talk with her that you're not trying hard enough. Why are you giving up? Why aren't you fighting more? Why are you doing why? Which I didn't appreciate, and I don't want to hear. I certainly don't want to hear anger at this point. So actually, my sister had to talk to her to try to make her understand that this is about me and my decision. And my sister and brothers, they would prefer that I wouldn't go on hospice, but they're also, they're understanding about it too, because they lived through what my husband went through, and our parents. There was cancer, so much cancer in our family. I've seen it since I was 16 years old.
I'm
So
starting to think there's something in your water there, Pam.
yeah, when I always said, because my dad there were 9 of them and 5 from my mother. So just about everyone died from cancer. So when I'd go to my regular GP, I'd say, we'd have discussions, and I'd say, this is way before. I'd say, it's not if I'm going to get cancer, it's when. And I asked her at one point too, I said, my GP, well, if you could choose between cancer and heart disease, what would you choose? She said, oh, heart disease, no question. So just listening to her, and my oncologist was wonderful. I set this up on my own with my GP. He's the one that said that I was eligible. And so when I checked in with my oncologist, she was trying to convince me that we could try other chemos and different things. And I just said no, I had made up my mind so early on that, and she was wonderful. She understood, and she said, call me at any time. If you want to try this again, let me know, we'll try it again. And so it was kind of a smooth transition for me because of my own attitude.
Yeah. In our Monday night groups, we've had people on both sides of the fence. We could speak about Gary and how he approved to both you guys' decision, but for him, he's fighting all the way. But in the end, he ended up needing hospice care in the very end, right? And the same with a few other people there. But the thing, I guess, both of you, is that whatever our decisions are, we want people to support it because it's our decisions. And Pam, like you said, or Barb, like you said, no one's forcing you to make that decision. It's your decision. And Pam, no one's forced you to make it. It's your decision. This is what you want. So as our support people in the background, they need to support our decision, right? So I know when people, my friends and family say, if there's anything I can do for you, can I help you? Can I help you? Like hearing that, you really know that they are truly there to support you, right? And I've not heard, I'm not in the same boat as either of you guys, but I know when I'm fighting for it and can I help you? And I'll know I can do this by myself, so Barb, so kind of in the same way for you, I don't have the question there in front of me, but how did your family react to it when you were saying but you've probably been an advocate for this for quite a while, so they kind of knew where you'd be going, but did you have any pushback?
Somewhat. I mean, yes, they knew I was advocating for this before, but it was sort of in the abstract at that point. It was just something I was fighting for, not for myself, but for people in general. When I actually was diagnosed with a terminal illness, one of my daughters said, basically, whatever you want, that's what we'll go with. The other one said, I don't want you to die. You're my last living parent. I don't want you to die. I don't want to be an orphan. And I was like, you're an adult person. You can, it's not like being an orphan as a little child. It took her a while to come on board with what I was doing. And I think I gave her the time to come around to my way of thinking, because for all of us, for anyone on this call, a diagnosis of pancreatic cancer is pretty traumatic, and there's a lot of adjusting you have to do. So I understand she was hearing all the horror stories about people dying in 3 weeks or 3 months, and she thought I was talking about this like I'm going to do this the day after tomorrow.
Yeah.
And my intention was to try to live for a while, and I was not thinking about it as the day after tomorrow. I do notice that people with pancreatic cancer tend to die rather quickly when they get sick. And I may never use medical aid in dying myself, because if it's quick, that's good. I think most people with cancer of any kind worry about a long, drawn out period of suffering, and nobody wants that. So I mean, I just continued advocating for medical aid in dying. I'm now the poster child for a group in the US, especially in the state where I live, where this is not legal yet. Because I will talk about the fact that I have a terminal illness. I will talk to any member of the press about what it's like to live with a terminal illness and face the fact that you may have to go to another state if you want to use this law. And I will go to another state.
Yeah, I know when I was diagnosed and people would come over and they give you a hug and they cry. Like if it was a cancer that's, I guess, a bit more survivable, I wouldn't have had as many tears from my friends and family, but they'd come over and they'd hold you and they'd just bawl. And I'm standing there comforting them, but yet I'm the one that's sick. And my wife, Karen, had said many times, like, if it was me, I would not have handled it the same way as you did. But I said to her, I said, the thing is that, you know, if it's 6 months down the road, I'll be gone in only 6 months. So I'm going to be sore and suffering and grieving whatnot for 6 months. But when I'm gone, everyone else who's going to miss me is going to miss me for much longer than 6 months. So it's much harder on them, you know? So that's how I was able to you know, I guess maybe to fight, like I wanted to be more than 6 months. Okay, so we'll move on. Anything to add in there? I know Pam, yeah, that's it. Yeah.
I just wanted to, what Barbara was saying too, that, well, from what I've read, that you can't just go to another state and have this happen. You have to be there for 3 months or something like that.
No, actually, okay, here's the law in the United States. In Oregon and Vermont, there is no residency requirement. You can go there today, and if you can find a doctor, you can do it this afternoon. Only in Oregon and Vermont, unfortunately, one is on one coast, one is on the other, so it's convenient. DC, I live in Virginia, about 5 or 6 miles from DC, and it is legal in DC. What you have to do is you do have to move there. You have to have a lease or a deed, and you have to have something with the DC address on it, like you have your bank statement sent there. And then you qualify. It's not residency like in the other states. The other states require that you get a driver's license and register to vote and really become a resident of that state and be there for 6 months. DC has the law is written differently. So I fortunately live really close to DC, and I have heard of people going over and renting a month-to-month lease apartment and then presenting that lease and the bank statement with the address on it, and they qualify. So different in each state. And Erin, maybe you know, I think it's different in every province in Canada. The rules are slightly different.
I think it's actually Canada-wide. When I looked at canada.ca, it seems to be Canada-wide, but again, could be wrong, but yeah.
Yeah, what I read is that it's legal in Canada, all of Canada, but each province has its own specifics of how you qualify for it, and I don't know what those are.
And it was like you had said, Barb, you really need to be like choosing it yourself. No one can choose it for you. Right. And it's that. And then like, again, and then they have the two different versions where one, the doctor or a nurse practitioner will give you the juice, or the other one is you take the meds yourself. So, okay. Pam, did you good with that? I know you had something to say, but you were good there.
Yeah. Well, I'll just say that I was going to say that I'm Catholic and I have a very strong belief, and anyone who's Catholic or knows that suicide is wrong, but now I'm in the midst of it. Everything changes when you're in the midst of it, and so if it were available to me here, I have a strong feeling that I would choose that medical assistance, because why drag it out?
Yeah. Well, it's, it's something I know everyone listening here, is this a topic that we want to be talking about? But it is, in the end, it really is. It is something that we need to talk about, and we can go back and talk about how things have changed over the years, for heaven's sakes. Like, people coming out of the closet. It took so many years. Now they can actually like live their lives because everyone's talking about it, and it's easier. It's much more acceptable. So this subject, both of these subjects, should be just something that you have a choice, and you shouldn't have to feel bad about it. And it seems like it's kind of taboo when people start to talk about it, but it shouldn't be, you know? So Pam, how many treatments did you try before making a decision to go into hospice care? Was it like oodles, or was it just a couple and you had enough of it?
No, I went through the series that she wanted me to go through. It was 6 months of gemcitabine and capecitabine, which is Zolota. And yeah, I went through the whole series, which was 6 months. And then they gave me 2 months off. And then I had the 28 treatments of radiation. And my second scan showed that I had some nodules in the lungs. They thought they were a little small to biopsy. And then the second time I had more nodules and two increased in size. And so I spoke with the pulmonologist, and he said that he could at this time take a biopsy. But I had already made my mind so strongly. I said, well, I'm not going to do anything about it anyhow, if it is. So why would I put myself through that? Because I had this, I don't know if this is a myth or what, that I thought that if he goes down there and takes a biopsy, could that maybe speed up the process of the tumors? I don't know, but that was my feeling. So he said, yeah, he said, if you're not going to pursue any treatments, he said, I won't do the biopsy. So, I mean, I don't know how many people make up their minds early on and feel okay about it and stick with it. But again, living alone and being close to my age, or the age I am, made the decision easier for me. I mean, we're all going to go at some point, and I'm 80
Right.
years old. So many people don't even reach 80. So yeah, it was. I forgot the question.
No, it was I forget where it was. Just how many treatments did you get?
Oh yeah.
Yeah.
So I
Like,
did, the first hold smear and all that, and went through a lot of initial side effects the first couple of weeks with the two I was taking. Terrible with my mouth, tremendous cold sores and canker sores, so bad that I couldn't sleep or eat or actually do anything for almost 9 days. And they were giving me every kind of mouthwash and medication, and I just had it was the Zolota actually that was the cause of that.
yeah. So like I know for me, when I went through my first round of the gemcitabine, Gembrac, whatever it was, I lost all my hair, which was fine. I don't have much to begin with, but the side effects, other than that, it was pretty good. And I tolerated it well. I only had to do 8 sessions of it. I could have done 20 or 30 because it really didn't bother me. I did find if the more food I had in my stomach the day of, it wasn't good for me. Yes, it made me tired like later on, but that was only for like 4 or 5 days. Then I could get back to normal. The second time around, after the Whipple surgery, I think what happened there was I wasn't as strong as I initially was prior to surgery. So my body couldn't fight the side effects as much, and that was the fluflorinox. And then the neuropathy came in, and I went in. I know I had the 5th session, and we were planning on going to the 6th session of it. And we saw the doctor, and he says, "Okay, this is your last session." I was like, "Oh God, great!" Because I said because I thought he wanted me to do 10, and I said I could probably do 10, but I don't know if I don't have to, I don't want to do them. But if he tells me I need to do it, then I'll go. But it is my decision in the end. And he said, no, you're done. And I said, okay, well, tomorrow's my last session. No, your 5th session was it. And I was like, oh, thank you.
Wow.
But again, I would have went, but I would have fought through it. Yes, I would have fought, but I didn't want to,
Wow. I had 18 sessions.
Of gemcitabine or you had,
Gemcitabine and capecitabine. She just
yeah.
cut back a little on the capecitabine. I did have 18 sessions.
Barbara, how do you think someone could approach the topic of choosing MAID to their family? I think we kind of covered that a bit, maybe.
Yeah, I mean, the way I approached it is I've been talking since the very beginning with this about, this is a terminal illness. I'm going to die from this. I might be able to put it off for a while, but it is going to get me in the end. And in some ways, I know Pam was talking about which is better, heart disease or pancreatic cancer. And I thought about it as which is better, pancreatic cancer or dementia? My mother and my older sister both had dementia. And it is not a pleasant thing to go through. I'd much rather have pancreatic cancer. So I thought, oh, I've been saved. And I talked about it that way to everybody. I am not going to get old enough to develop dementia. So this is a good thing. And you all need to think of this as a good thing. I am going to die before the age at which my mother started showing symptoms. And I sort of approached it in this with some dark humor, and which is kind of the way I approach things anyway. And I just started talking about it. And I know in the beginning, my daughter said it wasn't such a great idea to talk to her children, who are adult children, about it in this detail. But I have always talked to everybody about it, including my granddaughters, to say, I am going to die from this. You have 3 old grandparents. They were all going to die. I happen to know what I'm going to die of, and the other 2 don't have that. But I mean, I just kind of approached it with some humor to say, I'm okay with this. I'm not okay. I would much prefer not to have pancreatic cancer. But since I have it, I've come to accept it. It's the thing that's going to kill me. And I always like thinking about not developing dementia.
You know what's funny about when you say dark humor is a couple of months now, we're going to be having one of these weekend sessions on how we deal with our situation with humor, right? Gary was one of the biggest ones for that. He was always laughing and joking. Oh, I use humor to get through it. I did the same thing, so we'll get into that in a couple of months. But my stepson and my wife said, you can't talk about it that way. And I was like, well, why not? I'm the one who's sick here. He just wants to take a selfie with me looking like I'm sick. So I made some sick looking faces and we took a selfie. It's me. I'm not making fun of anybody else around. It's me,
Exactly.
And what I find interesting today with us is that both of you are looking at each other's topic. Like Barbara, you said, you know what, and I get to that position, I may choose hospice care. And Pam, you said the same thing. I may go and look at MAID. So it's very interesting. And again, I'm glad that we're having this conversation today.
That I wanted to add that my hospice nurse, I think I really lucked out with my hospice nurse. She's so wonderful and kind and empathetic and thoughtful. And she said to me, call her 24/7. And I didn't have that experience with my husband. The hospice nurse was very detached, very just into her little laptop. And I didn't really get much from her. But this woman is amazing. And I had a very bad week the last week because for some reason I just jumped from doing really well with thoughts and functioning and all to I don't know what triggered it about I think I was feeling a little bit weaker maybe, and my back was bothering me a little bit more. And so I went to a very dark place for about a week or so where it wasn't depression, it wasn't pain, it was tremendous anxiety about what's to come, because all I could do is keep reliving the last few months with my husband. From till I was awake, that's what I was doing. And so my hands and my feet were cold and clammy during all this time, except when I was sleeping. And I knew that that was anxiety because I don't have that ordinarily. So I was really struggling. And so, and then I couldn't sleep as much. So when she came yesterday, she reassured me so much, and I trust in her so much. And she knows my doctor now happens to be the hospice doctor, which is really great. And he's a personal friend of my sister and brother-in-law. And she assured me, and she does assure me almost every time. She says, I am not going to let you be in pain. She says, forget about that. I'm going to take care of you. You are not going to be in pain. And as far as thinking about my husband, she said this a few times over the weeks. Everyone is different. You don't, it doesn't mean you're going to go through what he went through. It could be totally different. And she did have a pancreatic cancer over the last year, a lady who also lived alone. And she said the lady did not experience, she went through chemo and everything. She did not experience the pain that everybody talks about until the last week. And that was it. And that, so she walked out of here. My hands were no longer clammy, or my feet. I felt a wave of reassurance. Oh, the other thing is I wanted to know who I can get to take care of me, because I don't want to burden my sisters. Or so she said she has a person, and he's been a CNA, and now he's going into private. And I told her, at first she said, would you want a man? And at first, when she brought it up a week or so ago, I said, really not. But then she said, she brought him up again. She said, he's just wonderful at what he does. And he's just, if I could. So she left, and within 10 minutes, I texted her and I said, I'm fine with the man. At that point, I don't think it'll matter to me. And as long as I trust you, her name is Linda. I trust you, Linda. I trust that if you know this person and you know how good he is over the years, I'm good with it. And so then that decision was made for me also, that I know that who hopefully will be available to take care of me in the last week or 10 days or whatever. So yeah, the hospice nurse has helped me a lot.
I have a comment on hospice, actually. I used to work in financial matters for older adults. And so I saw a lot of people who went into hospice at the end. They always waited too long. I love listening to Pam talk about this, because she's the only person I know who went in way in advance. And well, as Jimmy Carter too, has been on hospice for a year and a half. Oh no, for those of you who don't know, was an American president. He's 99 years old. I think going into hospice, hearing the support that Pam is getting is really useful for all of us to hear, so that hospice is not just a scary thing that has to happen the last of your life when you're in horrible pain. It actually is a support system. And I mean, I've been talking to Pam outside the group, and I know it's really helpful to her. And I think that's helpful to me, even though I'm not there yet. I will get there at some point. And knowing Pam's experience with it is really helpful to me.
You know, I find initially, Pam, when you came on and you told us that, I was kind of exactly where Barb had said, or where maybe other people would be, was like, oh, wow. But I was thinking hospice care initially was more on Barbara's topic, on MAID, right? But the more I'm listening, like, so I'm actually learning something today. Well, not today, but in the last few times we've been all talking, and I've been doing a little bit of research on both. And so again, happy that we're talking about this today. We're going to move on. I won't say the peanut gallery, but I just did, so I guess I said it. But our viewers' questions. Sorry, I have to put a little bit of that dark humor in there, Barb. It's not really dark. So, Aaron, what do we have? I know we have a couple of questions there.
Yeah, so foreigners, i.e. non-US citizens, also do MAID in Vermont or Oregon.
I don't know. I don't see why not, because you don't have to be a resident. I've never really heard of anyone coming from outside the country. I mean, if you're in Canada, you can just do it in Canada. So you wouldn't have to come to the US. But if you're not in Canada or the US, you're in some country where it's not allowed. I don't actually know.
Yeah, interesting. We'll
I
definitely
can probably find out and let you know, Aaron. It's only very recently that both Oregon and Vermont have changed their laws to allow non-residents.
Right. Okay, yeah, definitely. We'll keep you posted, Ralph. Said, wow, that's a great perspective, Barbara. That's great. Does anybody else have any other questions or anything that they wanted to chat about?
If we want it, there was one, I think with Pam, we don't have that. I have to ask you the question. Actually, the other one is already answered in there. The only other one is, Barb, what considerations should be taken into account when choosing MAID, and how do the criteria ensure a safe and autonomous choice? But I think we kind of covered that as well, didn't we?
We'd cover that. I mean, there are all kinds of safeguards of what you have to do in order to, you have to find a doctor who's willing to do it. For one thing, a lot of doctors are not. You have to find a pharmacy that's willing to fill the prescription. Like in the US, the big chain stores like CVS and Walgreens will not fill your prescription because they don't want to be picketed by people who are opposed. And so you have to find kind of a small pharmacy to fill the prescriptions for you. There are all kinds of safeguards, including, you know, finding the people who will do it. They don't advertise it because, again, they don't want people picketing outside their house.
I think in Canada, the guy years ago, back in the 90s, was pushing it, was Dr. Henry Morgenthaler. And those, if anyone's Canadians here are in their 50s, 60s, you would know, you'd remember the name. But it's funny when we talk about, you said people picketing and whatnot. I lived in Connecticut for a year and 4 years in the late 90s, early thousands, and I had a friend who owned a Christmas tree farm. So we're celebrating the birth of Christ, you know, and the lot where we were was an abortion clinic right there. So it was kind of like, you know, you could come out and you could, but you know, there could be people complaining on both sides and picketing, you shouldn't be here, but you shouldn't be here because of your religion, you know. So I don't know if there's any more that we all right, Chris just posted there in the chat. It was Dr. Kevorkian who helped the people with the MAID here. Okay, so now we got it.
The US as well.
Yeah.
All right, Chloe or Aaron, do you want to go through the chats where people were just saying whatnot they've been saying? So
Chloe's got her hand.
Aaron, you're on mute there.
Yeah, I was just gonna say Chloe's got her hand up there, so.
Yeah, I just wanted to thank you for this conversation. I think I've lost 3 family members to pancreatic cancer, and it's hard, I think, for everybody. It's hard for people with pancreatic cancer. It's hard for the families, and it's hard to understand why somebody's making a decision. I remember when I first found out that my grandmother wasn't gonna go on treatment, I was upset because I was studying it in school. I'm like, we have, you know, we can figure it out and we can fight through it, but really just respecting people's choices and then enjoying the last time that you have together, I think is so important. So I think these conversations really help everybody understand and spend some good time together at the end. So thank you for sharing.
yeah, you know, Chloe, it's like Karen was listening in. I shouldn't say listening in, but she was listening. But any of my conversations I have with you guys, she's always in the earshot, you know. And she was like, I don't know if you should be saying you're really excited, because Pam and Barb and I talked about this yesterday, really excited about, you know, someone dying and whatever and whatever. And I was like, that's not what I'm excited about. I'm excited that we're talking about this because it needs to be talked about, you know, just to make it more comfortable for other people. So once again, like third or fourth time I've said to you two, thank you very much. Like, and yes, I'm smiling here because again, it's a subject that we need to share, you know, and it's not a tough thing we need to talk about. Just like I said, for when people are talking about a divorce or if they're having an abortion, it's, you know, subjects that needs to be talked about, and we don't hide it in the closet forever. Yeah. So again, one more time, last time, thank you.
Yeah, that's great. It's definitely one of those like taboo topics, and I think it's really important to give people the platform to speak about it here, and to also be able to listen and be able to refer back to it too if they don't feel comfortable coming now. Super important. So thank you. It said, Pam, great to hear such a positive experience with hospice. I too am a widow also. And a big concern for me is who would look after me if my medical needs change without being a burden on my family. Sorry. Hospice sounds like they would fill that need. Thank you.
Yes. Yes.
Thanks, Judy. Are there any other questions, comments, thoughts that anybody wanted to share?
I just have a quick question for Barbara. You're talking about how where you can get the drugs. I would think that if you find the doctor the doctor could tell you where to get the drugs, right?
Yes, they know.
Okay,
It's just they
We're
don't.
not going to go into a
advertise it.
back alley or anything, right?
No,
right.
so there's a legitimate pharmacy in DC, but there's only one.
Uh,
Yeah.
Then my aunt was in sorry, I'm gonna butcher this name, Bruyere hospice a couple years ago. During COVID, they made visitors wear masks and face shields, and there could only be 2 or 3 visitors a day, and she couldn't go outside, so that was insane. These days nobody has to go through that, so I'll bet the experience is a lot nicer. That was in Ottawa.
Yeah,
Definitely.
COVID messed up a lot of things.
Yeah, no kidding. No kidding.
And now I just had COVID the other week, and someone said to me, "Did you? What were you out doing working? Why were you out doing this? And why were you out doing that?" Well, it's not against the law. It's just now it's just the flu. You know, we kind of have it somewhat under control until the next nasty virus comes along. You know, and then we have to deal with that again. So, but
Definitely.
anyhow,
Um,
like I know today this kind of went more on the talk about MAID, but I mean we had to talk about both, and it was a I guess it was a topic that came up, and Aaron and I were talking about. We want to talk, you know, we want to have something going on here, but we wanted to have kind of more than just one topic, which was great that we could facilitate the Pam's side as well. So I appreciate you both sharing your stories.
thank
Definitely.
you.
Yeah, thank you all so much for taking the time today to share your stories. And you know, it's a very vulnerable topic, and it's a hard topic to talk about, and I think you guys made it really easy and really you know, it made it feel a lot less scary, that maybe people can go away from this presentation and talk with their families and just sort of let people know what their wishes are. Because at the end of the day, it's a very personal decision, and definitely definitely a really important topic. So thank you guys so much for taking the time today to speak about your experiences. And Ben, thank you for facilitating again. Really great information. I see lots of thank yous coming through in the chat. Uh and yeah, just wanted to say thank you everyone for taking the time today to come. In Canada we have our long weekend this weekend, so really
Yeah,
pleased.
Canada.
Yeah.
Sorry, it's Charlie's shirt there. Not Charlie. Carly is
Curly,
Carly.
yeah.
Sorry, Carly. Yeah, sorry.
Um, so thank you everyone so much. If anyone needs anything, please feel free to email me, Erin@craigscause.ca. Any questions, I can pass them along to the speakers. And otherwise, I hope everyone has a wonderful long weekend, and we'll see you all soon.